and to also transform our education system so that it wouldn't matter who your parents were, how poor you were, where you lived in the state. You would have access to a curriculum that would challenge you and give you a chance to go as far as your hard work and aptitude would take you. And then when I was privileged to go to the White House in 1993 with Bill, there were a lot of problems waiting in that Oval Office. And in fact, the debt of the country had been quadrupled the previous 12 years. So we were in a big deficit situation. And through a lot of hard work, by the time Bill left office, we had a balanced budget and a surplus, and we were back in control of our fiscal future. We also tackled health care, a problem that is a tough one. You know, President Franklin Roosevelt decided that he could do either Social Security or health care, but two were just too much. President Truman took on health care and ran into a brick wall of opposition. And when President Johnson did Medicare and Medicaid, he knew he couldn't add universal health care on top of it. But we wanted to try because we believed, and I believe to this day, that it is just morally and economically wrong for the United States of America not to be able to figure out how to provide health care to every single man and child.
We weren't successful. But I am proud we tried, because it's important to keep trying. You know, I was raised that old saying, if at first you don't succeed, try again. And sometimes you learn more about people from times when they don't succeed than the times when they do succeed. And so when I looked around, I realized that there were a lot of other problems when it came to health care and children and families that we could address. A lot of people said, well, she'll never talk about health care again. They didn't know me. So I went to work. I helped to create the Vaccines for Children program. And now every year in Iowa, 225,000 children have immunizations against childhood diseases. By someone you may have heard from or heard of in the years since. Her name was Elizabeth Glaser. When she had her first child, her daughter, she had to have a blood transfusion. She contracted the AIDS virus. And she had her second child, her son, before she was diagnosed with the disease.
And all of a sudden realized that she had not only contracted it through the blood transfusion, but passed it on to both of her children. She came to see me in 1992, even before Bill was inaugurated, and said, we have no idea what the effects of these drugs on our children are because they're not testing drugs for kids. So I decided to get the FDA to issue a regulation requiring the drug companies to test drugs on children instead of just prescribing them without knowing the appropriate dosage or whether they should even be given. The drug companies didn't like that, so they sued and they overturned the regulation. And then I had the great pleasure of going to the Senate and passing a law to require the drug companies to test drugs on children before they can be prescribed. And then I worked to create the Children's Health Insurance Program. That's the program you know here in Iowa as the Hawkeye program. 50,000 children in Iowa now have health care because of the Hawkeye program. 6 million around the country. That's the good news. The not so good news is there are still 50,000 children in Iowa. They're not poor enough for free aid. Their families don't have an employer who helps them buy insurance or a good union contract that guarantees it. So we still have 50,000 in Iowa without health insurance and 9 million around America. So I joined with a bipartisan coalition of members of Congress, and we have passed twice a bill to expand health insurance for our kids, and George Bush has vetoed it twice. I am looking forward to becoming president and asking the Congress to send me that bill so I can sign it and we can expand